Hi there, my name is Greg Spooner. I'm a doctor of physical therapy at Fiziologix Physical Therapy, where I do telehealth for those all across California and Washington State. And then for patients that live in and around the greater San Diego area, I actually do mobile on-site physical therapy. Now, I set up telehealth a long time ago, and it just so happens that now, as we're all sheltered in place, it's become a remarkable opportunity to still be able to continue to serve your patients in a way that is safe, convenient, private, and secure. And the thing that I love most about it actually is that for many of the different maladies and dysfunctions that I treat, I utilize what's called the McKenzie method. And it's something that I use on myself when I get low back pain or sciatica type symptoms. But the gist of it is that when we're working online together, it's not just about fixing the patient, which is what many of them tend to want and need, but it actually has to do with empowering them, so that way they can learn how to understand what they're feeling, what it is, and then they can treat themselves and take over. And so what that means is that is less time in a state of disablement, less time feeling the aches and the pains and the loss of function that end up bringing them to you in the first place, seeking some sort of relief, whether it is a medication or a referral to another specialist. For the mobile physical therapy, right now during shelter in place, following close CDC guidelines, wearing a mask, eye protection, and gloves, I will go in and I'll work with people who are post-operative as well as any acute people in their home. So keeping everybody out of the clinic, keeping them out of the community, but still giving them the opportunity to move better and feel better and function better, because despite the fact that life is really changed right now, human bodies don't change. Now, some things that we do treat actually also in telehealth are some of those post-op patients. So especially those who have received a recent total hip replacement or total knee replacement, somebody who is post-operative with shoulder surgery, for example. Telemedicine, teletherapy is great for that because you don't necessarily need hands-on at first. You can teach the patient the majority of what they need to be able to do and the majority of the things that they need to monitor. And if there is somebody that they live with, somebody on site who can facilitate their care, that education can be done right here in the telehealth environment. So it's a wonderful way to maintain continuity of care, to take some of the burden off of your shoulders as a provider as you're trying to help ensure that your patients stay safe, stay happy, stay healthy, and also keep the pain levels down while keeping the function up. Now, if you have never actually experienced teletherapy for yourself, I definitely encourage you to reach out to me. I'd love to connect with you securely on my telehealth platform. If you are already familiar with it, fantastic. Either way, please get in contact with me either by phone at 619-363-2227. You can either call or text. You can also email me, team@Fiziologix.com, and I'd love to connect with you to see how I can help your practice.